Good evening and thanks to everyone for joining us today. I, Ankit Dogra, along with my teammates Dr. Deepika Chhabra and Ms. Ramit Saxena from Medical Services Jagsonpal Pharmaceuticals Ltd, welcome you all to the episode 1 of the series Pearls of Wisdom by Key Opinion Leaders, organized by the Society of Meaningful Life Management with academic partner Jagsonpal Pharmaceuticals Ltd, makers of Divatrone, 10 mg tablets of micronized dydrogesterone, indigenous and affordable for a safer and smoother journey to the motherhood. We also present Inj Maintane, 500 and 250 mg depot 17 alpha hydroxyprogesterone caprate to maintain normal pregnancy till the term, and LycoRed Preg sachets of L-arginine, Lycopene and DHA for high-risk pregnancies. A warm and hearty welcome to all the esteemed speakers, experts, and the attendees. Dear attendees, we request you to post your thoughts or opinions by the text in the Q&A box. Please note this webinar is streaming live on the Facebook and the link has been shared in the chat box. To refer to this webinar in future, please visit our YouTube channel, Jagsonpal Medical Insights, for the complete recording of today's program. We are pleased to start this new webinar series with Dr. Maninder Ahuja, a progressive, thought-provoking leader who created processes of going digital, online voting, e-newsletters, and online journals. She is founder president of SMLM, past president IMS, Faridabad Obsgyne Society, vice president SAFORMS, executive member of many societies dealing with the health of women like ISAR, IFS, ISPAT, and NARCHI. She has been felicitated with many awards and has many publications and research papers to her credit. We will now request Dr. Maninder Ahuja, ma'am, to kindly initiate the series. Over to you, ma'am.
Thank you, Mr. Ankit Dogra, and good evening and welcome to all the delegates, all the faculty, and especially thanks to start with Dr. Jackson Pharma, which has been our technical collaborators for, I think, since the SMLM was launched in 2020. So thanks to them. And we'll start proceedings immediately after short introductions. Short introductions because our speakers and faculty, they need no introduction. They are celebrities in their own way, and they can hold the platform like Amitabh Bachchan can hold the dance single-handedly, so they can hold the platform single-handedly. So the first, our speaker is Dr. Jaideep Malhotra, and then the Manthan or the discussions will be taken over by Dr. Sharda Jain and Dr. Nikita. Dr. Jaideep Malhotra, she has traveled throughout her life through various professional organizations, and she is the one woman who has headed national and international organizations. You name FOGSI, IMS, ISAR, ISPAT, Aspire, and she has been there. And not only that way, she has excelled herself in the women entrepreneurship, making her own apps and everything. So she is in reality an innovative and forward-looking leader. And she was one of the persons who started with the idea of Adbhut Matritva. Now, Adbhut Matritva perhaps has been known to us in our epics Mahabharata also, where Abhimanyu was listening to Krishna and he could listen how to go through the Chakravyuh. So later on, the science took it over, and they have the evidence to prove that there is in utero origin of many diseases. But beyond that, we know that the baby starts listening to the mother's voice and the noises and music around baby around 15, 16, 18, 20, 22, 23 weeks of pregnancy. So that means there is some scientific basis where we have to look into, and our speakers today will be talking to you on how to make it clinically relevant, because whatever we are discussing in these webinars will be relevant to the professional organizations and individuals, medical health professionals in their clinical practice, as well as in their dealings with other organizations, media, patients, and everywhere. So that way we are going to make these webinars meaningful. The another aim of Society of Meaningful Life Management is to reach out to many people. So we'd like to keep it to as much as possible digital, except where we have to do some hands-on training sessions. And then the research somewhere can be done on from the digital platform also. And we are very soon starting our research on the relationship of menopause to metabolic syndrome, along with collaboration of IMS, forms, and many other societies. So without wasting much time, now I'll hand over to Dr. Jaideep Malhotra for her Adbhut talk on Adbhut Matritva. Welcome, Jaideep. She has been to me like a sister also. This is not off the record, on the record only. And I have told her always, I am like an eklavya, and I'll be always learning from you, though silently. Thank you, Jaideep, for being here.
Thank you so much, Maninder, and a very good evening to all of you. My Manthan chiefs here, Dr. Sharda, Jain, and Nikita. Very good evening to you both. And you both also have been an inspiration in a lot of things which I have done in my life. And Maninder has always been there with me, shoulder to shoulder. So this is a really, really very nostalgic for me to come and address this topic on her platform. It's very important. There's only one life to live, and once we have only one life to live, we need to definitely make some meaningful contributions. So what an apt name for the platform, Maninder. Congratulations, and looking forward to living and contributing meaningfully to in every possible way when we have come into this world. Now, I'm going to talk on a very important and again a very thought-provoking subject, which has been very close to my heart right from day one. I am the third generation obstetrician in my family. And we have another one coming, fourth generation is also there. And we as a family have also delivered second, third, and fourth generations. So you can imagine there are many a times there have been so many examples, like Maninder gave one example from the Mahabharata, but there are many, many examples where you see the grandmother, the mother, then the daughters or the sons, and you correlate with all the episodes which were happening in their pregnancies, and then you say, oh my God, why did it not strike to me before? And this is something which is very, very important. Now, this talk is for people and families who desire to bring a very healthy baby in this world. It is also meant for doctors who know that their small time invested in a pregnancy which comes to them will have actually long-term impact on the future generations. So we are the custodians of women's health, and we should be providing whatever best information, care, love, and affection we can actually give. But as a mother, the mothers who are listening, I'm sure all of us are, as a mother is the most prized possession of any family. And that's again something, caring for the mother, because when we say mother is the one whose love and whose care is unconditional, and she is absolutely a priceless commodity, I would say, where we cannot afford to even think of not looking after her. But if we really look after her well, then the kind of impact which we will have in the future generations is something which I am wanting to deal with. Now, let us think. We have a population in India of 135 crores. And almost 50% of them, more than 50% are men and a little less women. We have almost about 1.8 crore births happening in our country every year. and we lose about 45,000 women during childbirth. Now, we are very, very proud today because we have, brought down the maternal mortality ratio down to 130 in most of the country, but our target is much different. Our target is 70 per 100,000 women, and that's something which we should be aiming at. But we have not, in spite of all the struggle which we have done, we have not been able to bring it down further, which is something which again gives you food for thought. Similarly, infant mortality, we have brought down to almost 32 per 1,000 live births, and that's in the best of the states like Kerala and all, but we are looking at much lesser. And why we have not been able to bring this down is again a $1 million question, which we would definitely like each one to understand. Now, let us face the facts first. Now, when we are looking at the numbers, if you look at the number of births which are happening, all out of those 135 million, 56 million have maternal anemia, 42 million have maternal obesity, 26 million have maternal malnutrition, and 21 million have maternal hyperglycemia, and about 8 million have maternal hypertension. Now, just understand this. These are some really mind-boggling figures which are there, which need our attention, because not only these problems are leading to the problem to the mother or adverse outcomes in the pregnancy, but they are also laying the foundation of future diseases in the future 2 generations at least, and maybe 3. So we have to understand that our care has to be beyond only the care which we are giving, because 1 in every 2 Indian pregnant women is anemic. We are the diabetic capital of the world. In 2017, we recorded almost 72 million cases of diabetes. And what did we predict? That these are going to double by 2025. Can you imagine now the numbers? And this prevalence is really going to lead to a lot of morbidities and also the foundation in the future generations. 68% of the under 5 deaths in our country are because of child and maternal malnutrition. On one hand, we say we are the obesity capital of the world. And on the other hand, we say that 68% of us are children and mothers are malnourished. Now, that's something which has to again be looked into. Now, China and India have almost similar amount of births per year. But can you look at the figures now of the preterm birth? We are the preterm birth capital of the world. Our numbers are 3 times as of China. What is it that is what we are not really doing right? Now, let us come to some figures about the non-communicable diseases, because today I can understand that today when we are losing mothers or children, we are not losing them to the standard causes of maternal mortality like sepsis and infections or hypertension or something like that, or PPH, which used to be the major killer. Today, majority of them are because attributable to the non-communicable diseases, which are really rising exponentially in our country. And the one major problem which is there is that typically if you are looking at any country, the NCDs present themselves around the age of 55. When we look at cardiovascular diseases or ischemic heart disease or stroke or something, in India, they present themselves about a decade earlier. Now, understand the impact of all these, because these are the ones which are really leading to a lot of, and with this talk, I have many purposes in my mind, which I hope all of you will catch when we are looking into it. Every household, I think, will have somebody who is having a malignancy. Every household. I don't think there's any family who would be left around, because again, look at the rise of cancers in our country. 45% increase has been there. Now, a lot of times we say that, it's all about genetics. Now, what is genetics and what is epigenetics is something which we need to understand. There's this beautiful song by Paul McCartney, which used to say, though it takes a lot of power to make a big tree grow, it doesn't need a pot of knowledge, for a seed knows what a seed must know. Now, what does it mean? That everything to make this tree grow into such a big tree is all there in that seed. But if I ask you today that I'll give you seeds of this tree, grow them in different places, will they all grow into this big, this strong, and this larger tree? The answer is no, because it's not only the pot of knowledge which the seed is actually taking along with it, it's also the environment. It's also the kind of nurturing which we actually do for these plants or these seeds, the kind of manure which we are going to put in. It's all going to, the environment is all going to play its role in making this tree grow into this large, strong, fruitful tree. And that is something which we need to understand. So there is something called as genetics, but there's also something very, very important, which is epigenetics. And environment plays a big, big role. So we normally keep on looking at, when a lady gets pregnant or is wanting to get pregnant, tumne ye khaya, tum jara sa yoga kar lo, ya tum thoda exercise kar lo. We are not even looking at so many things, like the kind, what is the environment around like, what is that environment in the house like, what are the contaminants that she is using, because each one of us has loads of measurable contaminants in our body which actually act as endocrine disruptors. If I tell you today that I don't smoke, but I am actually smoking 6 cigarettes sitting down in my room in Agra because the environment has those contaminants inside, and without even smoking or having any vices, I am inhaling all those. Similarly, the makeup which we are using, the plastics, the processed foods which we are eating, all of them are bringing in endocrine disruptors, which will actually have an effect on us in the long run. And especially what is very, I would say, scary, that newborns are being born with a level of these ubiquitous contaminants in their blood. And that is something is very, very scary, because what are these environmental contaminants? If you're looking at the makeups, as I said, the plasticizers, the pesticides, the green vegetables, which we so fondly eat, we don't even wash them properly. They have lots of pesticides in that, and the preservatives which are there in our foods and are in cosmetics, the sanitizers. We are using sanitizers for the last 2 years, left, right, and center. And we need to understand that they have, again, a lot of impact, will have a lot of impact on our future generations. And of course, the air pollution. I mean, it's unbelievable the amount of air pollution which is there, and especially in Delhi, Faridabad and all, the air is absolutely beyond any inhaling. All these are actually acting as obesogens, diabetogens, thyroid disruptors, neurodevelopmental disruptors. They also have an impact on the reproductive system and are also fertility disruptors. Now, when do they really affect these environmental disruptors? They can affect on every and at every stage of life, whether it's intrauterine. I told you newborns are being born with their good levels of these in their blood during the perinatal period, puberty, and also in adult life. Now, these are some things which we cannot see. The only things which we knew when we were taught of what to avoid in pregnancy or early pregnancy was, please take folic acid to look after the neuro development, and also see that the thyroid is also in place. So iodine deficiency should not be there, because otherwise the baby can have some problems. But other things we had totally overlooked. But today, there is mounting evidence which is present with us, which says that from preconception onwards to prenatal to early development, there are many things which actually will influence our programming in our body of our babies, which will have a lot of effect on the times to come. Now, I'm sure many of you must have read many of these books, on fetal origin of adult diseases. Now, what has really changed in our understanding between this debate of genetic and environmental determinism is that our knowledge about epigenetics, the effect which epigenetics has on the genetics, is actually changing and has increased a lot. Let me ask you a question here. You can see 5 mice here. If I ask you which one is the one which is really healthy and the best of them, a lot of people will say that this one with the very nice shiny yellow coat is the one which is probably the healthiest. If I tell you now, this is the mouse which is obese, is more prone to diabetes and cancer, because the DNA methylation in this mouse is actually the affected one, you'll understand what I mean. Now, similarly, let us understand that if a mother is exposed to any of these issues, now it's not only the mother who's exposed, it's the baby also who's exposed, and the germ cells of the baby are also exposed. So these health effects will, once they have an effect, they are going to cross 2 generations and maybe more. So this is something which we need to understand, that yes, genetics and epigenetics both have a very great role to play. So it is not only your DNA that is your destiny, it is also the lifestyle, the diet, the stress factors, the nutrition, the mental stress and the behavior which you face. They all have an effect on the outcomes. And I'm just giving you a very small example here, that we worry so much about food and the medicines and maybe sometimes exercise, but the mental status, the perinatal mental health of the mother, hardly we feel. Because I've made a film on Adbhut Matratva. If you have some time, it is there on the YouTube. You must watch it, because the anxiety and the stress and the depression sometimes, these women, most of the times I would say these women carry with them, have an impact on the methylation patterns, and these will have a long-term effect on the future generations. So when we look back now today, can we really avoid any of these: undernutrition, overnutrition, obesity, hypertension, hyperglycemia? Because these are the ones which are very commonly associated with considerable maternal morbidity and mortality, and also poor pregnancy outcomes and fetal programming. And this is something which we have to really understand. So let's look at the undernutrition effects. Now, when we are looking at the effects of undernutrition, now most of the times when the fetus is undernourished, I'm just going to make it very short for you. We have to understand that there will be a development of insulin resistance, hyperlipidemia, hypertension, and central obesity. And this will again lead to type 2 diabetes and coronary heart disease in the future generations. And similarly, overnutrition again has a mechanism where will lead to macrosomia and fetal adiposities and islet dysfunction, again leading to hyperglycemia, insulin resistance, and a load of other disorders in the times to come. So if I tell you today that when we focus on early antenatal care, even that is too late, because by the time a patient reports to you, let's say at 5 or 6 weeks when she's pregnant, majority of the stuff has already happened. It is too late to prevent some birth defects, because the critical period of teratogenicity is there. The heart starts beating at 5.5 weeks or maybe earlier sometime. And the neural tube closes about 28 days after conception. The palate also fuses. It is too late to prevent any implantation errors. It is too late to restore allostasis and maintain, stability through this change. So what is really important today? Any pregnancy with a long-term impact is the preconception period. So if you're looking at, or if you're investing in the preconception period, the value of your investment is going to be very high. Now, as we go into the pre-implantation and then the early first trimester and then the late pregnancy, the value starts coming down. So we must look at the preconception period, which is the best time to optimize the health of the mother so that the outcome in the future generations is much, much better. And if you see here that pre-pregnant to pregnant to adulthood, when we are looking at the disease and disability, now all these, what is happening here at the gametogenesis period or the ovarian and the uterine developmental period will have an impact in the later life. So minus 12 weeks to plus 8 weeks is the time which needs your maximum attention as a mother, as a doctor, or as a family. And that's very, very important. So if we optimize all these factors before a lady gets pregnant, then all these major problems because of low BMI or high BMI are going to be much lesser in our future generations. Let us not only concentrate on the mother, because a father's role is also equally important. And it has been seen where the fathers are also obese, there are decreased pregnancy rates, there is an increased pregnancy loss. And when we look into ART, the embryo qualities or qualities also affected in these couples. So optimizing the health of the couple before any pregnancy is planned is something which we should be definitely looking into. Along with it, paternal obesity also has an impaired glucose tolerance test in the babies. So a father's role or contribution is also equally important, and that also should be definitely looked into. Now, why are we really worrying about it? Let us now understand that if a mother has hypertension in pregnancy, very surely a few years later, she will be fully hypertensive and has more likelihood of having cardiovascular diseases or cerebrovascular disease or kidney disease. Pregnancy is a window which actually shows you what you are really likely to get in your later life. Similarly, if somebody gets gestational diabetes, she is most likely to become diabetic within the next 5 years if she doesn't really take care of. So it is like an alarm which hits you and says that, okay, please look back and look after yourself. Now, similarly, when premature babies are born, premature babies are also more likely. Now, these babies are more likely to have cardiovascular diseases in life. So when we are the prematurity capital of the world, what kind of a future generation we are building? This future generation is going to have all kinds of problems in the times to come. So it's very, very important that we look at our genetics, but we also look at our epigenetics and lifestyle modification. I'm so happy and so proud of Maninder, because she has been unrelentlessly promoting lifestyle modification, and she herself is a role model for that, because at that age, cycling, gymming, and whatnot. So, and that is something which is you have to live by the example and look after not only yourself but also about the future of your whole generations. So as obstetricians today, let us understand that we are so privileged that a woman who is planning a pregnancy or who is pregnant is actually in touch with us for almost 1 year. And as I said, sometimes for generations, because she comes, her mother comes, mother-in-law comes, her children come. So if at every visit when they come, if we are able to impact on their life, on their understanding, small thoughts, generate those thoughts and say that, okay, if you are going to do this, then this is the results which are going to happen in your future generations. This positive motivation is very important. And I think we are the privileged ones who get this opportunity many times in a pregnancy. Now, all of us, I would say, all of us know what we know. But I would also like to say that knowing is not enough. We must apply it. And willing is not enough. I'm sure all of us are willing to do it, but we must do it, because unless and until we do it, the impact is definitely not going to come. So that holds true for all of us obstetricians and also for our patients. A lot of times patients also say, "Mujhe malum hai ye nahi khana chahiye, lekin doctor, what should I do? I just feel like eating." And so as a good doctor, now who's a good doctor? A good doctor is the one who bridges the gaps between science and society, who understands science and is also ably and efficiently able to transmit this to the beneficiaries for them to understand that, yes, all this knowledge or this medicine is more than the sum of knowledge about the disease, which in the kind of magical relationship which we share with our patients is going to have an effect on the generations to come. Now, as a good mother is also very important, because a good mother should not only think about herself. The good mother has to think about her baby. Now, and a good parent, I would say, not only a mother, as a good parent. Now, I have seen the 1 in 3 face domestic violence in our country. Now, when you tell the couple as a whole that, yes, this baby is listening to all that what is happening around in the surroundings, I have seen couples changing. And that is something which is very, very important, because sometimes when you just counsel the patient or the couple that, you should not be fighting, or there should not be any domestic violence, it doesn't really register. But the moment you say that it is going to affect your future generations, health-wise and personality-wise, it definitely has an effect. And these small opportunities should not be lost, because these actually are the beginning of the greater achievements which we are looking at. So I would just say that, yes, there is in this whole program, there is a definite plan on what one should be doing in the preconception period, then in the first trimester, along with all the screening processes, the physical activity, the nutrition, the diet, and the screening for genetic anomalies, along with an integrated strategy, which is very, very important, which should be definitely all of us should know, and we should do it. And these are very small things which will bring in big changes in the times to come. Along with that, what we have done, one very important part is of newborn screening, which again is a very ideal procedure which we should be looking into. So if we know and if we don't practice, I don't think we know. So that is something which we should be focusing on, because what we normally focus is that this lady who has come to us, she should remain healthy and she should go back with a baby. But what we are trying to say with this program is that we should not only look at the short term, but we should also look at the long-term health benefits, which will happen with a very small changes which we will bring about in our care provision and in the patient understanding. And this is a kind of integrated health systemic approach we should be looking into. So what are the components of any journey of motherhood, which is going to be an incredible one? It starts with preconception counseling and a good antenatal care, along with diet and nutrition, some yoga, exercise, music, meditation. A lot of people worry about cosmetic care. And what we normally do not worry about is birth preparedness. Now, birth preparedness and complication readiness is something which, if we are really looking at, will definitely improve the bond of the patient with the doctor and the clinic. It will also improve the bonding of the baby with the mother and the family, which is very important. And lot of times it takes care of a lot of litigations which happen because of this unprepared attitude, which may be there either with the doctor or with the patient. And that's something which we should be looking at. It is a very good time to immunize her and also counsel her about the immunizations. Let's say if she has not taken the HPV vaccination or hepatitis vaccination, she can obviously, take post-conception, post-delivery, and also postpartum care. That's again a very great period because you need to counsel, you need to prepare her for spacing in birth, during the pregnancy only and not in the postpartum period when she is least receptive. So these are the small changes which we should be definitely looking into. Now, why Adbhut Matritva? Because as a obstetrician, my only aim was that, yes, this patient or this pregnant woman should have a very beautiful experience, and this journey of her in pregnancy should be an incredible one, and the outcome also should be really good. Now, this Adbhut Matritva is a program which is based on two things. One, which we time tested and we have known for centuries, and that's Garbh Sanskar. And unfortunately, we do not acknowledge, like yoga. Now the world is doing yoga, and today we are now doing yoga, but we had yoga all these years and decades and centuries with us, but we did not realize the benefits of it. Now the world put this Garbh Sanskar as fetal origin of adult diseases, and today we are realizing, this was a science which we had known, and these 16 sanskaras are the ones which we can actually educate the baby inside the womb. And this mindful pregnancy is definitely going to bring in a lot of mental and behavioral and personality development, along with reduction in the disease in the future generations. And that is something which we should be definitely looking at. Along with that, what is very important is that women, now I can quote many studies, but this is just one of them. Women who are actually practicing Garbh Sanskara, they have much reduced stress and their coping up strategies are much better. Now, this is very important. Why it's important? Because a lot of time you'll see fear of these young girls who are getting pregnant for delivery. Now, birth readiness or birth preparedness for a normal delivery, especially because we as obstetricians are facing the brunt of so many litigations and all that we've done, undesirable numbers of cesarean sections. Now, the problem is not with us. The problem is that, yes, these pregnant women, we have not prepared them well to deliver normally. And that, again, has to be inculcated with all these practices along with the medicines or it's very easy to write a prescription, but that prescription should include preconception advice. It should include lifestyle modification. It should have an element of, now gender discrimination is something which or avoidance of domestic violence, which we are really looking at. Now, you will ask me, how in a small interaction period of 5-10 minutes, I can give so much advice or counseling to the patient. Now, it is absolutely unthinkable, because when we say that we have almost 2 crore pregnancies or births in our country, we have only about 100,000 gynecologists who are delivering them. So it is next to impossible for us to keep on giving them so much information at every visit. So that is where this app, iMoms app, was developed, because all that what is required, the essential knowledge to nurture the mother and the baby, are all provided by this app. And I'm very happy to say that this app was awarded the Pradhan Mantri's Atmanirbhar App Challenge Award. This app actually today has about 400,000 women who are logged on, almost about 500,000 women who are logged on to it. And this app is an ever-developing app which gives you a lot of insight into the diet, the yoga. We do sessions in the morning for yoga, meditation. We do question answer sessions while leading obstetricians of the country and abroad on the questions which you may have. Now, the best part I would say was that during the COVID, when hundreds of these women did not know what to do, where to go, the sessions which we used to have in the morning and the evening actually helped them steer through these very, very difficult times. It has stories for baby bonding, for parental bonding, pregnancy music. You have experts who are there to advise you at every point of time. Now, what was the purpose? The purpose is only, it's free. Anybody can use it, so feel free to recommend it to your patients. And if you are patient pregnant women who are listening to, please go ahead and use it. There is a premium version which gives you some extra care and advice, but the basic version is well worth anything. Now, what are we really looking at with these thoughts and these acts? The first and the foremost, I'm sure each one of my friends would understand, is that all of us want to make motherhood a blissful experience. It should be something which a woman remembers, the kind of care, the love, the affection, the pampering she got from the family and also from the doctor and the clinic, because all that is going to have an effect on her and also on her future generations. We also need to develop a bond between not only the mother and the child, that's always there, but also the mother, the father, the family, and the baby, which are very, very important. Bonding of the couple with the doctor in the hospital is very important for them to have a good experience, and also for them to develop this bond would also facilitate in them delivering normally, which is what we are definitely looking at. We want to allay the fear of vaginal delivery, and that's something which can only come when you develop a bond with the couple and the family. Now, sensitizing many important aspects of pregnancy and postpartum period, especially breastfeeding. Let me put it, or postpartum contraception. And today on the app, we have now another section of mindful babies, where we have added information for couples who have children less than 2 years. So they can also log on to the app and get that extra information they want to bring, because the first 1,000 years days in the life of the baby are the ones which lay the foundation of all that what I'm talking about. So sensitizing them about every aspect of pregnancy, postpartum period, and bringing up children is something which is very important for us to look forward to building future healthy generations. And that's something I would say that this concept, it's nothing new, but how it has to be integrated and be provided is something which we should be definitely looking at. This is a movie which is there, Adbhut Matritva. If you have time, please go through it. I would really feel very, very happy, because it will actually tell you how these young working couples, the kind of problems which these families face, and especially women, because at that young age, career-oriented women have to do everything apart from, completing their families. So let us be the custodians of their physical, mental, and pregnant health, and build a future healthy generations. Really, thank you from the bottom of my heart for this opportunity to interact with each one of you. Thank you very much.
Thank you, Dr. Jaideep. I think, as usual, that was an extraordinary explanation of the antenatal, intranatal, and postpartum events, and whatever you are doing for the women of this country is very important. But I'll give my comments about your pearls of wisdom later on, because it is the prerogatives of our moderators, Dr. Sharda Jain and Dr. Nikita. The only thing which I will say is, you have said rightly that though antenatal period is the window of opportunity, but that opportunity is too late, and we have to start thinking of that before they get pregnant, so that we can have a healthy intrauterine and post-uterine period, postnatal period for the women of this country. Dr. Deepika, will you please show the slides of Dr. Sharda Jain, because I have to give a little small introduction to my mentor who taught me how to keep the time management. I'll never forget it, Dr. Sharda Jain. In every webinar, I always remember it, because the key to success in life is just one thing: time management. Because every time people will ask you how you are doing it, how it's possible that you can do so many things. And Dr. Sharda Jain is herself an example of that, because she's there to help each and every cause towards the women's health. So whatever she is doing in her clinical practice, that is, of course, a lot of things, because she's having practically, but what she's doing for associations is extraordinary. And she has been advisor of health to National Commission for Women, chairman of Women Wing, and so many other organizations, which I think people know her very well, those who are attending this webinar. And this webinar will be not only on the website of Jagsonpal, but on the website of Society of Meaningful Life Management, SMLM, in also, as we are sharing all the webinars and all the power presentations on that website, so that you can watch with your convenience also later. And Dr. Nikita, she is the new coming up, our futuristic, innovative person who has really now started thinking into future by going into Garbh Sanskar. And that is really, really praiseworthy. To you, Dr. Nikita and Dr. Sharda Jain, for your comments, and to take it forward for another 10 or 15 minutes.
See, we exactly have 11 minutes time. And I think at the outset, I must salute Dr. Jaideep Malhotra for taking this particular journey, which was really amazing, mesmerizing talk. I'm not going to repeat what she has said, but
It's gone. Voice is there?
seed
Net problem?
is very important, is very, very important. At that particular time, they used to have a preconception preparations. And those preconceptions preparations was muhurt nikala jata tha, sab kuch chanting hoegi, and then the conception will be brought about as a result of the same. And then it did not end there. As Madam has said that, 3 months prior to conception, your preparations definitely get started. If you have not done that particular job, whether you're physically okay, whether you're emotionally all right, whether you are mentally all right, and your health is also all right, then only you prepare for a child. Then it did not, our heritage did not stop at that. During the conception time, it empowers the mother. First in making the mother, and then it empowers the mother ki aapko andar ki qualities honi chahiye, so you can transfer all those qualities to the child. And I think the people who have worked on preconception and the people who are working on the conception can definitely see that the pregnancy they sail through, as Madam has said, that they are the ones who can really cope up the pregnancy stress so much better. They can cope up all the people around them in a much better way. And I think, what I find in the last, since the time Dr. Jaideep, you were the president and you grabbed this particular opportunity, these people, that this particular part must be highlighted. I can see in the last 5 years that, people are utilizing, the experts have come now in the field who prepare the newly couples, how to prepare themselves for parenthood and how they sail them through, and they charge money for this. So I find, this is something area which we must really work on it, because not only this is going to take care of the child's health, which Dr. Jaideep has highlighted very, very well. She's highlighted. Pregnancy is like a window. Remember, pregnancy is like a window. जो भी mother को होना है 10 साल बाद, वो आपको सब कुछ pregnancy के में दिखाई देगा. If the gynecologist has been very careful, she can highlight कि ये सब चीजें problems आपको आने वाली. But what I'm trying to say, this country needs to become a superpower. अगर हमें जगत गुरु बनना है, तो यहाँ के हर soul को empowered होना बहुत जरूरी है. उसके लिए good human being होना बहुत जरूरी है. So first, the mother is going to empower herself with the purity, with peacefulness, with gratefulness, responsibility, loving, helping. Those kind of emotions have to be there, because any single emotion which we have, any thought which comes, the emotion will be created. If it's a positive emotion, हम अपनी सारी दुनिया स्वर्ग बना लेते हैं because of those vibrations. अगर एक जरा सा negative thought आ जाएगा, तो सारी दुनिया नर्क बन जाएगी. So this is what we need to inculcate to the parent, that your thought only will make so much of difference. And you talk so much of epigenetics, it's all emotional. It's all emotional. Me and Nikita are sisters. We have a very strong family history of cancer, but if I am positive, I can avoid that particular thing by epigenetics. And if I am negative, I will definitely imbibe it. So I think with these particular work, I will leave things for Nikita, because in this particular field, Nikita is much senior to me as this, and we will definitely wait for the comments. Dr. Nikita.
Nitika will give you extra time for this, I think.
Okay.
No problem, ma'am. It's been an honor. आप सबके बीच में, I feel so inspired. I feel कि something which I was just visualizing and I was going through. I actually went back 20 years in my own pregnancy journey when I understood, when I started reading in 2013. And I was going here and there and talking to people, but till finally both of you actually took out time and you took it to a platform that we're all benefiting. And I feel so happy, internally happy to see sub-gynecologists, they are working on it and they are talking about it. In 4 years back, nobody was talking about it. Taking a lecture also on this used to be, what is birth psychology? Are you a psychologist or are you an obstetrician? Ma'am, miracles hote hain. Every day hote hain. Honestly, I feel मैं obstetrics छोड़ चुकी होती if I was not doing this project. But now every obstetric journey is like a, no, it's not like a challenge also, but it's also like a beautiful divine experience. You see how babies connect to you also. I have actually talked to babies in the womb while they are delivering. Actually, ma'am, ये शायद मैं कभी नहीं कर सकती थी, because that's only knowledge. Like you said, everything is in the mind. We can all tackle preterm births. We can all tackle so much. जैसे हमारी capital ma'am said, ma'am has such beautiful statistics and figures. मुझे लगता है मैं मैम से एक दिन बैठ के ना सारे लिखवा लेती हूँ अपनी PPTs के लिए, कि कुछ scientific facts भी बोल देने चाहिए मुझे. But it's wholesome. But I always feel, like ma'am said on the app, once you're on the app, you are all the time taking care of this mind. And if you dispel the fears of the mother, you actually do everything. You know, you humanize birth. नहीं तो birthing की जो journey है ना, वो interventional हो चुकी है, ma'am. And all of us know, and even I was like that only, but now it's changed. What इतनी छोटी सी चीज है, we have been delivering mothers in lithotomy positions. Have we ever told them in 9 months, you choose your position? That is going to make that thing easy. And then inductions, if we reduce, then labor is not that tough. Because हम रख लेते हैं अपने पास, it becomes long, prolonged, so much of talking, so much of effort goes in. So this birth psychology, Adbhut Matritva, Virtue Baby, our own spiritual journey, our spiritual powers, which we have tried to collate and join, has given result to this, what all of us are actually working at. And I think हमारे पास वो real chance है to change not just the life of the baby who has to come, but also of the entire pregnant family. And हमें mindful practices चाहिए for our pregnant families if we want to actually create a beautiful, peaceful, happy world. And that's definitely there. And सिर्फ baby नहीं, family. और वो families भी इसलिए बन जाती है because it comes out from us. And anything else, if anybody wants to ask any question, because personal
these
experience,
two aspects,
I think,
you know, what Dr. Jaideep highlighted,
Yes.
our girls do not do any exercise.
Yes.
There are 3-4
Yes.
asanas need to be done, and if you want to have a vaginal delivery, and I'm
Yes.
told, I'm sure about it. If you practice this throughout the pregnancy, which is nothing, it just takes 5 minutes in the morning, 5 minutes in the evening. If you do it,
Yes.
you will have a vaginal delivery. So, but
Yes.
if you have not exercised yourself, then probably things are not going to happen. The dialogue of the mother with the baby is the bonding.
Bonding.
Is the
Prenatal
bonding.
bonding.
And this bonding is not only with the baby, with the father to the baby, and with the people around it. You can feel exactly when the father comes, who's the expectant father, and is happy. You can find this child is jumping. If you find that the grandparents who likes this particular diet, this child is jumping because he conveys to the mother, look, somebody important has come for me. So this is the kind of things are very, very important. And I think, each and every line which Dr. Jaideep has highlighted, that, you can make a preconception period, the antenatal period, absolutely a great journey where you can feel what is happening. There is a whole lot of awareness is there. And I think, we can develop the personality of the child right in the utero. The IQ can be great. Your vibration of the gynecologist can make a lot of difference. Then you can find that this particular child EQ can be great, and he can cope up with all life stresses without any problems. His spiritual bent can be also there. So you can see, you can make that kind of personality. And I think we should definitely, each one of us should definitely put some time onto it. Not only we should become a great obstetrician of the modern times, but we must also take our Indian heritage along with us, and we can definitely make a great future generation. So Dr. Nikita, if you want to add on something in the last minute.
Yeah, just one last moment, one last thing which I want everyone to just understand. Sometimes this birthing journey, we may all be very focused and we may be doing the best. The mother is very well prepared. Everything goes well. We may land up in a vaginal delivery or even an emergency cesarean. It's our prime responsibility to spend 5 minutes after the delivery with our little angel. Whenever we go on the next round, please share it with the baby. What happened? Why was this birth stressful? Everything is fine now. Even if we apply a vacuum sometime, or we do an emergency cesarean, or the baby's heartbeat dipped, talk to the baby, and honestly, just talk, spend 5 minutes. You will see baby seeing in your eyes, and you will see baby respond. Because it's our responsibility that if we have given birth trauma, it's not that we have given. We have been there. The mother and the doctor have to share the birth story of the little baby with the baby, because that is healing. And that imprint which the baby is going to carry as a womb memory is going to change his personality later on. So please give these extra 5 minutes, share. ऐसा हुआ था, सडनली आपकी हार्ट बीट डिप करी, तो हमें चेंज करना पड़ा प्लान आपका. हो सकता है आपका कॉर्ड आपको टाइट लग रहा होगा, बट आप बाहर आ गए. अब एवरीथिंग इज ओके, एवरीथिंग इज फाइन, योर पेरेंट्स आर ऑल फाइन, दे आर गोइंग टू टेक वेरी गुड केयर. एंड मैं तो सॉरी भी बोल देती हूँ मैम, क्योंकि मैंने एक्चुअली में वर्कशॉप अटेंड करी थी बर्थ हीलिंग पे. वो एक्चुअली में बेबीज को जब हिप्नोथेरेपी में व्हेन दे टुक, दे सेड दैट डॉक्टर वाज सो रफ. She put something on my head, on my cheek, and she pulled me out. I will never forgive that doctor for this. I have attended that workshop of that hypnotherapy tape. So it's in me. So वो भी बोल देना चाहिए, अपना account भी clear. And moreover, we will see baby को breastfeeding problems, bonding problems, ये बहुत कम होते हैं. फिर बाद में the baby is very well connected to the family if we do this. So I thought this is something which I now have started doing since a year or two. So it's giving me good results. And breastfeed me, if the baby is not breastfeeding also, please talk to the baby. Explain it to the baby just like the mother is being explained by the doctor. The mother has to do this with the baby. It will help.
Okay. Nikita,
Thank you so much, ma'am.
You here talking to baby or to the mother has really filled me with the very positive vibes. And my message to all the delegates who are attending, you are blessed that you have attended this webinar today. Please take those feelings with you. Take those feelings with you. That is what, as a good obstetricians, we have to develop. And that is my message for all of you today. I am blessed to have this webinar. You are blessed to have attended this webinar. Please carry this message forward. Each of you become a torch bearer. Our next webinar is already fixed on 22nd, because we'll be having on the 2nd and 4th Wednesdays of each month.
Okay.
Second will be by Dr. Hema Divakar, and she will be talking on the artificial intelligence for the safe women health in this country. So that is also going to be very, very important. But please carry home spread this message to everybody of Dr. Jaideep Malhotra, Dr. Sharda Jain, and Dr. Nikita and myself, is that when you deliver a mother, deliver with feelings, with love. She feels it, the baby feels it. I tell you, when the mothers have come to me, they are not feeling any fetal movements. And just I talk to them lovingly, I keep my hands, make my hands warm and keep on their abdomen. And the fetus, they start jumping around. So that is the vibes they are getting. If you talk to them, like Nikita said, they will listen to you. And tell the parents, mother and father both, and their grandparents also, that each and every one of should talk to those babies when in utero, if they want to have a healthy and Adbhut Matritva and the healthy babies and healthy generations later on. So I think we have finished in time. 3 minutes are excusable. Next time we'll keep just 15 minutes extra so that nobody can blame us for those 4 minutes or 5 minutes. Thank you very much, Dr. Sharda Jain, Dr.
Thank you,
Nikita,
ma'am. Thank you.
Dr. Jaideep Malhotra, because she had to leave. She has another international webinar. And Dr. Deepika, you are always a great friend. You are always there to help me. And we will be giving mementos. Please show them at least now. They will be delivered to you physically by the Jagsonpal. So we are just showing them as a gratitude from the Society of Meaningful Life Management for being there for the delegates and for all of us. Thank you very much.
Thank you.
Thank you very much. Thank you very much.
Thank you, ma'am. Thank you so much. Thank you.
Thank you, Deepika.
Thank you so much. And for just a reminder that the Jagsonpal has recently launched Divatrone, micronized dydrogesterone 10 mg tablets. We are looking forward to a very good support for the new brand, the new baby. Also, we have Maintain injection 250 and 500 and LycoRed Preg sachet to prevent pregnancy complications. So we see you again for our next webinar, which is now day after tomorrow, that is Saturday. This is also from the Narchi Delhi team. So hope to see you again. Bye-bye.